Hi and welcome to this introductory session. I hope you're going to enjoy it. It just gives you a brief idea of what dental phobia transformation is all about, and it kind of just wets your feet a little bit before you embark on the journey. So hopefully you will think it's worthwhile and you will join us for our 10-part series. Okay? Hello and welcome. Thank you so much for taking time to join us for this session, this introductory session. These lessons that will follow have been prepared carefully and customized for you, with special attention being taken and given to the specifics of your dental related issues, which we would have discussed. So first of all, I want to commend you for taking such courage and strength, because it does take that, in making the decision to take this very first step on the journey to overcome dental fear and anxiety. It is not an easy journey, but it is a very rewarding one. My name is Dr. Christine Botchway. I am a general dentist. I am not a therapist, and neither am I a psychiatrist or a psychologist. And whilst I will be walking with you, alongside of you, on this journey that leads to empowerment, I will not be doing the homework for you. So it is you who will be doing your homework, your tasks, your exercises. Some people don't like me to call it homework, but it is homework. So we can call it tasks, we can call it exercises, and it is you who will be making the choices. It is you who will be making the changes, and ultimately it is you who will be stepping into the empowerment and the transformation that will occur in small but significant steps as we embark upon this journey. Now, whenever I give that introduction, I always want to say, just for explanation, that it's not because I want to be mean, or it's not because I don't want to help you too much, but what it is as you will learn later on in the exercises, that it is absolutely impossible for a person to work on behalf of the transformation or the complete inner change of another person, because it is that person that needs to actually be present in the experience that leads to these changes. And you'll learn why as we proceed in this conversation. So let's go on. Okay, so let's just sit back, let's just relax, and let's embark on this journey. So some form of dental anxiety is often experienced by people on a temporary basis, especially when they're unfamiliar with an office, a staff member, or a new procedure. However, dental phobia is different. Dental phobia differs from dental anxiety because it is not dependent on knowing what the procedure is, or who the staff member is, or being familiar with the office, though familiarity can certainly help. Many patients get frustrated with themselves and say that despite what they know, they have still experienced the terror and are unable to have the procedure done, other than, of course, under GA or sedation, which doesn't really count. For example, a patient might comment, "I know that the procedure doesn't hurt," or "I know it is just a tiny pressure," or "I know it will not hurt to have that very wobbly baby tooth out." And hence they're baffled and confused and frustrated as to why, once sitting in the dental environment, they experience terror and are unable to have the procedure done, or worse. If this is you in any way, hang on tight, because you are about to understand why. And by virtue of understanding, you are going to take a first step in this journey to altering the course of dental phobia. Now, the reason that knowledge or knowing about the procedure does not help to quell phobic fears is simply because the root cause of your fear is not ignorance. It is not lack of knowledge. The root cause of your fear is your belief, your unique, specific. So this is the part where you say, whoa, 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 back up now. What are you talking about? What is she talking about? Belief? What is she saying? Okay, let's go through this. It is belief. This is why it is so difficult to get to it, because you can't see it, you can't cut it, you can't move it, you can't lance it, drain it. All right, let's talk about belief. Everything that you believe is part of a complex connection of organized, established thoughts that live in your subconscious mind. And these organized thoughts are called belief system. And this belief system establishes a sort of reality or seeing glasses for the way you view everything pertaining to that phobia or fear. And the way in which you see everything pertaining to that phobia is called perception. It's called perception. In life, your perception, or the way you see a certain thing or phobia, makes your body respond as though what you see is actually physically true. And because in a way, what you hold within your soul gates is true, and if you believe it's true, then your body responds as though it's true. I'll give you an example. If you were in the woods and you got what you thought was a bite or a scratch or scrape, and you thought it was a bite by a poisonous black widow spider, you could begin to experience symptoms of shortness of breath, increased heart rate, even itching and nausea, until you realize that what you thought was a black widow spider was a black fuzzy ornament that you'd stapled to, say, your glove that scratched you. All right, and then the symptoms, once you realize that, the symptoms, they disappear. Okay. Another example is you take a new energy drink and you feel renewed, refreshed, amazing. Oh, now you take it every day, and most of your old aches and pains, they're gone. You can run a mile. However, a few months later, the physician tells you that the drink is mainly water and organic flavor with not even any nutrients. You say, well, that can't be right, but it is right. It's proven. So how did you feel so amazing? Welcome to the placebo effect. All right. So the placebo effect is a phenomenon that's observed by science that acknowledges that what we believe in our minds can cause our bodies to respond in a certain way. So now we get the point. I'll start with the examples. Let's talk about the subject, or let's get to the subject of understanding your two minds. Yes, you didn't hear wrong. I did say it. Your two minds. We're going to talk about your... Okay, so you have two portions to your mind. The mind with which you sit down and read a document is called your conscious mind. I'm going to simplify things quite a bit. When you're paying attention, when you're relaxed, when you're happy, you are using your conscious mind, or the part of your mind called the conscious mind. When you're learning something for the first time, when you're focused, you are using your conscious mind. The second portion of your mind is a part called the subconscious. It means it's under the radar of the conscious mind. And everything that has ever happened to you in your life, everything you've ever heard, or seen, or experienced, it's stored in that subconscious mind, and it can be recalled when needed. For instance, often used phone numbers or passwords, right? They are in the subconscious mind. As an adult or a teenager, your subconscious mind is closed. So you get to choose what you put in it, in your mind. In order to learn and retain something, you have to use repetition, to have things enter and be retained in your subconscious mind, so you can recall them for, say, an examination. Get it? Therefore, when you're a teen or an adult, largely you are in control of what goes into your subconscious mind. You can do it by repetition because it's closed, right? Those gates are closed. So in a way, you're sort of a gatekeeper of your mind, of your subconscious mind, unless, of course, you abdicate that right to peer pressure, which is possible, folly, or anything else that allows you not to guard the gate of your mind. Guarding the gate of your mind is very, very important. But as a child, your subconscious mind is open, wide open, and anything you experience, good, bad, ugly, gets stored there, and it gets stored in the form of thoughts that are charged with an association of energy, emotional energy, which is called a memory. So I'll give you an example. If you often visited your grandma for wonderful summers and you watched her bake delicious apple cinnamon pies, the smell of apple cinnamon pies will most likely evoke the thought of wonderful, lovely grandma and those wonderful days, or at least the emotion of joy, right? But if you entered a dental environment with all the smells and the sounds and the visuals of dental or medical and had a fearful experience, a series of thoughts charged with the emotion of fear would be stored in your subconscious mind. And that would mean that at any time, any dental smell, sound, visual could potentially trigger the memory associated with all the emotion of fear. The situation would then be viewed through those looking glasses or perception and of the trauma, of course, and the body would react as though this trauma was occurring again in reflex fashion. Okay, this is just a summary, so I hope you're getting it. I hope I'm not going too fast, okay? I will slow down in the lessons where we'll get lots of examples and lots of tasks or homework. So, dental trauma could be described as an invisible impact on the subconscious mind of a person, which disables that person from perceiving, assessing, and achieving the ability to make their rightful, authentic choice and embark upon their authentic and rightful path, right? Pertaining to anything that is concerning that subject of that trauma. So in that capacity, they sort of become like a little bit challenged, disabled in that capacity. And if untreated, that trauma remains forever dormant in the individual, becoming the guide in their subconscious, of course, becoming the guiding path of that person's life choice pertaining to that subject. And sometimes not only that subject, because that kind of trauma is like a weed. It gets into the trauma of fear is like a weed. It gets into different areas. It begins to control people's life and hinder their choices. So, in other words, the person who has suffered this trauma, though their conscious mind, the one that knows, the one that is aware of what's going on or thinks that it's aware of what's going on, right? So though that conscious mind tries to exert its rightful choice, its authentic choice, I want to go to the dentist, I want to get this tooth filled, it finds that the conscious mind is undermined, it is overrun, it is vetoed by the subconscious mind. And the subconscious mind, which controls the belief system, wins. Hands down, it wins every time. So dental phobia is based on dental trauma. It is a real wound. It is real, that cannot be seen, but which influences the beliefs, the formation of beliefs in the subconscious. It influences the perceptions, how we see, and ultimately, and most importantly, it influences the actions pertaining to that subject. In most cases, without the person actually understanding why, because it's coming from the subconscious, the hidden mind. It's always in conflict with the conscious mind. So the person might think that they're going crazy. I want to do something, and something else is saying no, right? It's the subconscious mind. It's two minds that are in conflict. on that subject, right? And so without even that person understanding, which further adds to their sense of powerlessness, their sense of frustration, and it manifests in its many forms or faces of fear on the activation of a variable trigger. And I just want to go back to and explain when I say the many forms of or faces of fear. Fear is one of the low vibrational emotions, but it has many manifestations. Many times I would go into a clinic setting and I would meet a patient who was very hostile, very insulting, very abusive, very agitated, and then I would find out that right behind that was fear. And it was you get to know, or you get to see it and understand it. So it would manifest, the fear, which is the root cause, would manifest in many ways because it's strategy to avoid. If I'm hostile enough, I can get out of here, right? So this is really the path that fear tries to take. It tries to manifest itself, and sometimes it will manifest in hatefulness, in all kinds of manner of behavior, and in loudness, and just in a way that that sort of syncs itself with that emotion of fear. And when I talk about the activation of a variable trigger in phobic patients or fearful patients, the thing that would activate one does not activate another. So if someone would freak out at the sight of a needle, and the next person who is phobic and genuinely phobic doesn't care about the needle, they would be fine until you take them back in the chair and lean over them, and that is what triggers it. Or it could be the smell of zinc oxide eugenol, which used to be the smell of dental offices, and it's not anymore, thank goodness. Could be the sight of a white coat, could be the sound of a drill, it could be the scraping of an instrument, it could be even just the scent that the nurse had on that day when the trauma occurred. So this is where the trigger that sets off that reflex reaction is variable, and the fear that is trying to enact the avoidance strategy, also that face of fear takes many forms. So whilst general anesthetic, GA, and sedation may alleviate symptoms of phobia and may be necessary in emergency situations, the actual trauma will still await the patient when they awake, because they have not consciously participated. Note that they have not consciously participated in creating a new experience with a differently charged emotion. And for that, only they can do it, and only their bodies can do that. And of course, they have to be conscious to experience this and to participate and to create this new emotionally charged experience which replaces the old. And so this is why I was saying in the very beginning of this talk that you have to show up, you have to participate, and it is not the guide who will do the homework for you or the task or the exercise. It will be you. And if you do this, and if you go through the steps step by step, and if you listen to the voice of your intuition, which is also within you, that says you can do it. You are fearfully and wonderfully made and created. You are not created for fear. You are not created for fear to guard your gates. You guard your gates. So it's time for you to step on this journey and go step by step, commit to doing your exercises, whatever they may be, and do it with the knowledge that you are a fearfully and wonderfully created being. And your journey is amazing, and fear does not have the right to steal it. Thank you. My name is Dr. Christine Botchway, and I'm glad to have been with you today, and I hope this was helpful. Shalom. Hello, and if you're interested in taking this course, it is a 10-part course, and I would love you to just sign up and register, and welcome aboard. All right, thank you. Bye.